just to level set, as everyone knows, ChatGPT is, a generalized large language model that's, readily available, being used by everyone, including, MDS researchers, clinicians, the general public, and a lot of different functionalities. And so it can be anything by create an email or generate a post to, doing some extremely complicated tasks, answering, very challenging, multiple choice questions. But what we don't really know, or we don't have a grasp on, is how does these large language models handle complex patient cases? Specifically, a complex patient case like an MDS case, where there's, a lot of, very subtle changes in the WHO, ICC classifications, treatment paradigms, prognostication for these patients. And so it was a big, area that was sort of wide open. Is this good? And the reality is that generalized large language models currently are not very good at handling complex cases. The struggle is they often have outdated information, and they often can even create fake information. We call that hallucinations. And so we wanted to, try to improve on that by, our work, which is creating a virtual tumor board. And so what does that actually entail? So what we did is created a group of AI agents. So AI agents are, you can think of it as a small program that's powered by a large language model, almost like a chatbot, but has a very specific defined task. And so in this particular case, we built out an AI agent that is considered a moderator agent. And so that agent's task is to take a patient's case, structure that case, and then feed it to an additional agent. The next agent is a diagnostic agent. So the diagnostic agent uses the latest WHO, ICC guidelines, references those guidelines with the patient's information, and provides that, classification. We have a prognostic agent that references IPSS-R, IPSS-M, and is able to calculate both of those. And then we have a treatment agent that is able to reference NCCN and other therapeutic guidelines and ultimately generate a treatment for the patient. And then we have a clinical trial agent that ultimately works on generating a clinical trial output, referencing clinicaltrial.gov and other clinical trial resources. That data all gets sent back to the moderator agent that then creates a very nice structured summary and ultimately provides that summary to the person that input the information. And so what we did is, we actually tested 30 patient cases. These were not real patients. These were, generated patient cases on using this multi-agent platform, which we call our virtual tumor board. And then we took those outputs, those summaries, and compared it to other generalized large language models like ChatGPT. And really what we found is, using this multi-agent framework, we were able to significantly improve on the outputs that ultimately came out, and were much more consistent with what the experts would expect. And so, kind of the next phase, and the phase that we're currently working on, is we got a panel of expert MDS researchers to blindly review all of the outputs, both our multi-agent output as well as additional outputs, and compare them, and ultimately provide feedback in a blinded fashion. And then we are, analyzing that data and ultimately submitting that data for publication. But it's an extremely, can be an extremely useful tool. And I think sort of the future of how we think about this, if you have a tool in front of you that is able to provide very quickly and efficiently diagnosis, prognosis, treatment recommendation, and clinical trial recommendations for a very specific case, it's extremely valuable for both community and academic providers to have that tool, even if they're not necessarily, using that tool for every individual patient case every day in clinic.